Sciatic nerve pain is terrible. It's that pain that starts in your low back. It works its way down your leg, maybe going down your hip, into your knee, into your foot. And you have these nervous type of feelings when you have it. Sometimes it can be debilitating and movement is really difficult. Well, in this video today, I'm gonna walk you through how you can decrease and alleviate your symptoms of sciatic nerve pain. If you have a bulging disc, a herniated disc, or a compressed nerve in the low back, these exercises and movements should help you tremendously to bring that pain back up the leg, to alleviate your symptoms, and ultimately allow you to move better at the end of this video. Welcome to the Vulcan Blog. My name is Dr. Sean Hiller. I am a physical therapist and a certified strength and conditioning specialist, and I am going to walk you through the exercises that I would do or that I would give a client that I'm working with for sciatic nerve pain. I'm going to walk through these exercises with you. We're going to do them together. So if you follow along at the end of this video, you should have less symptoms, less pain, and you should be moving better than you were when we first started it. Before we dive into the movements, let's talk for a second on what sciatic nerve pain is, what you should be feeling while you're going through these exercises, and what you should be experiencing as you're going through these movements. If you're doing these movements and you notice your symptoms start to come up the leg, they start to what we call localize or centralize, that's a good thing. We want that to happen. Even if your pain is a little bit more, if your symptoms are centralizing and localizing, you should be moving better at the end of the video. If your symptoms are peripheralizing, if they're moving further down the leg, if your pain levels are significantly getting worse, then these exercises may not be the right ones for what you have. They're great for those three issues we talked about: bulging disc, herniated disc, or a compressed nerve. You may have something else going on. We have another video that, and we'll link to later on, and treat that particular type of low back pain if your symptoms are getting worse, if the pain is going further down your leg. Sciatic nerve pain in general is when you have nervous type of symptoms that typically originate in the low back, sometimes the hip, and they move down your leg, and this can be tremendously painful. If you're going through this, I'm sorry, this is not fun, but we have used these same exercises I'm about to walk you through on many of our clients. I've used them myself, and they have great success in decreasing those symptoms. And when you do them consistently, they have been proven to bring your pain levels down, allow you to defeat this sciatic nerve pain. So save this video, come back to this video, and do it daily so you know exactly how you can decrease your symptoms. So let's get started. The first movement we're gonna go into is you can do this on the table, you can lie on the ground. This is a sill press. So from this position, you're gonna press up as far as you're able to. So if you press up, and this is as far as you can go without your pain levels becoming more painful, without your pain levels exceeding really a 4 or 5 out of 10, then this is fine. We're gonna do the movement here. If you're able to press all the way up into a good sill position, this is what we're looking for overall, and I want you to use that full range of motion. If your pain levels, again, stay below a 2 or a 3 out of 10. If you're doing these exercises at any time and your pain levels exceed a 2 or 3 out of 10, then come down, reset, and find that area where your pain is uncomfortable but not super painful, okay? If you're starting these exercises and you're like, Sean, my pain is already a 10 out of 10, then you're just gonna have to move through it, but we don't want your pain to get exceptionally worse. Make sure it stays where it is or starts to decrease. So for the sill press, we're gonna start, and we're gonna go through 10 of these sill press, just nice and slow. I want you to hold at the top for 3 seconds and then come back down and take a little bit of a breather at the bottom. We're gonna push through this sill press for a 3-second hold. And you will feel some tightness in your low back. You will feel a stretch maybe on the front of your hip. You might even, if you've had a lot of pain, you might even notice that your muscles are twitching. You notice that your body's reacting kind of funny because it's been in such a shocked state. So we're gonna move through these, again, for 10 reps. I think I've done about 5. You guys are counting, I haven't been. And again, each time, if you're getting to 5 or 6 at this point, hopefully you're starting to notice that your back is loosening up. And the entire time we're doing these movements, focus on where the pain is in your leg. If you started this and the pain was going from your back all the way down to your foot, hopefully you're starting to feel those nervous symptoms move up your leg into your calf or maybe into your knee. At the end of all of these exercises, the goal is to have that pain totally localized, either in your low back or at least in the hip. So we'll move through these, again, 10 times. Going to go through the last rep here. So number 10, getting about that 3-second hold at the top. After this, we're gonna go into a single leg mule kick. You can do this lying on the table or on the ground, either one. But we're gonna do one leg at a time, and we're just gonna do 5 reps for each leg. I'm gonna start with my right leg, and I'm going to put my heel, and I'm gonna try to touch the ceiling with my heel. Hold it for about a second or two at the top, and come back down. Okay, we're gonna go through 5 of these each leg, and you will feel a quite large glute contraction. You will feel that your whole glute start to fire. And a lot of times when we're dealing with this sciatic nerve pain, one of the first things the body does is it shuts off your strength and it shuts off your power. So if you've had this on one side and not on both sides, then you'll probably notice that the side that you've had the nervous symptoms on is very weak at this point. It might be quite hard for you to actually lift your leg like this. If you can't, it's fine. What I want you to focus on is trying to take your heel and touch the ceiling. If you're not able to get your leg off the table or off the ground, but you feel a good glute contraction, that is totally fine. You're in the right area. Just keep trying to contract that glute. And after going through this, you may eventually be able to get the leg off the mat, and that is already improvement. And again, we're looking for those symptoms to decrease as we go through this. Now from this prone position, we're gonna go up onto our hands and our knees on the table or the ground. And from here, we're gonna go into a bird dog without the point. So I'm not a pointer dog, I'm not putting my hand out, we're just gonna do the legs. So I want you to come back, 1, 2, and switch. Something I want you to focus on with each of these movements is you can see my low back. My low back is not going into this big extension point, and it's also not humping over into flexion. It is staying what we call stacked. My low back is trying to stay as flat as possible. You're going to feel another pretty large glute contraction here. And again, we're gonna do, with these, we're gonna do 6 each side. And what you'll notice is the side that is not affected is a lot stronger than the side that is affected. But at this point, we should be seeing some of those symptoms start to come up the leg. After 6 each side here, we're gonna roll over onto our back. And we're gonna go into a glute bridge. So I'm here, you're going to bridge up. I want you to hold at the top for 5 seconds. After 5 seconds, come back down and start again. That isometric is a big deal in all of these movements, all the holds that we're doing, another word for a hold is an isometric or a pause. That is the most important part of the entire movement. So if you're getting tired and you're unable to do all the reps, that's fine. I'd rather you decrease your reps, but keep this isometric here. We want to contract your posterior chain, your glutes and your low back quite a bit. Okay, so we're gonna go through 5 of those with that 5-second hold. After the glute bridge, we're gonna roll over one more time. And we're almost out of these exercises. We have 2 more movements left. And we're gonna do what's called a Superman tap. So Superman flies. So I want you to take your hands, you're gonna lift your hands up, and then from here I want you to tap the back of your head. Okay, we're gonna do 10 taps, come back down and rest. We're gonna come back up and we're gonna do 10 more taps. All together here, we're gonna do 5 sets of 10 taps. That's gonna contract our back and then give us a good extension movement to allow those nerves to continue to come up. And then the final movement we're going to do is called a SOTS press. That is S-O-T-S. It's famous after a weightlifter who made the SOTS movement famous. But this is excellent because we're taking all these movements that we just did and we're getting you into a standing position, which might be difficult at this point for you. But you're gonna take your broomstick, your pole, your dowel, your PVC, whatever you have, and we're gonna go into a little bit, you can see my hips, a little bit of a hinge. So we're not standing straight up, we're going into a little bit of a hinge. So we're starting to get more functional with our movement, which is something we have to try to do with these. And we're gonna take our dowel and we're gonna put it behind our head. If you struggle with putting this dowel behind your head, if you can't do it, that's fine. Keep it on the front and we can do the movement from here. But I want you to get the dowel behind your head and in this position with your hips back. See me, I'm sticking my butt out. I want you to stick your butt out when you do this. I don't want your knees to come forward. Butt should be back. I want you to press up, hold at the top for 3, and come back down. Press up, hold at the top for 3, come back down. I'll show you from the front what this looks like. Press up, hold at the top for 3, and press back down. As far as your grip on the dowel, you can see about where my hands are. If you can, the more narrow you go, the better. The wider you go, that's not what we're looking for. You can start here if you need to, but try to work your hands in as you go. One more demonstration. Hips are back. 1, 2, 3. Guys, those are the 5 movements that we're gonna do to decrease your symptoms. If you have just finished that SOTS press, I want you to stand back up, reconvene, find out where your symptoms are. Are they moving further up the leg? When we started, where were your symptoms when we started? Are they now further up the leg? How are you feeling? Are you moving better? Does your back feel a little bit more relief? Are you still having the nervous symptoms, but are the nervous symptoms less? Are things getting better? That's a great question to ask. If they are, then what you need to do is take these same 5 exercises, and I want you to go through these exercises for 2 more rounds, and your symptoms should continue to come up. If this has helped you, you need to make it a priority to do these every single day. Like I said, pull this video up. We can continue to walk you through them, and this should continue to let your pain levels decrease, let these nerve symptoms start to go away, and you can start to move back into function and better movement. If you've done these exercises and you're thinking, my symptoms are worse, my pain is worse at this point, this hasn't helped me, then you may not be in that category that we described at the beginning of the video. You may be in a different category. I want to ask you 2 simple questions, and this is for you if these things have helped you and if they haven't helped you. The 2 simple questions are, do you like sitting or standing better? And do you like to lie flat on your back or on your side in the fetal position better? Which one do you like? If your answer to those questions are, I would rather be standing than sitting, and you'd rather be lying flat on your back versus your side in the fetal position, then these exercises that we just did are great for you, and they're gonna help you continue to do them every day. If you answered the other way with those, you may be dealing more with stenosis or degenerative disc disease, DDD. That may be more of your issue. These exercises, while they can help some people with those issues, they don't help the majority. If this is you, then click this other link and it will take you to a video to treat those symptoms. The exercises are very different, but again, we have found that those exercises have helped those people as well. So if that's you, if you answered the opposite direction on those, go to the other video and that should help you. But guys, hopefully these exercises have helped you. You've started to notice pain relief. You've started to notice your symptoms start to decrease. If so, do them every day and they should continue to help you. If this has helped you, please like this video, subscribe to our channel, and ring that notification bell. It helps our channel so much. We're able to reach more people so that they can be helped with exercises like this and get out of pain. Guys, have a great day, and we'll see you next time on the Vulcan Blog.